I think you have to look at health as a whole. It's a whole being, just like um, the impact it has from diabetes, gingivitis, same impact it has on your eyes through optometry and stuff. So you have to address the person's well-being as a whole.
Access to dental care. We see the waiting list is too long, 3-4 months. To just get in for prevention, screening, and then it progresses through the system. But just that initial access to a dental screening appointment is difficult and frustrating.
We have limited resources in health service. We have a population that's isolated in rural communities. Small populations, rural communities have a tough time getting into the dental clinic for care, and we don't have a strong presence, I think, in the hearts and minds of people.
American Indian people in Arizona on tribal lands and urban areas experience rates of decay significantly greater than any other population in the United States.
When it comes down to brass tacks, the dentist can't do it all. The parents can't do it all. But an Indian community investing in the promotion of oral health can do it. And who's in charge of that community? It's the tribal leaders. And the tribal chairmen are the ones that should have the pride, should come forth and be completely and total advocates for their communities, their tribes, their own tribal people, so that they can be proud that they have a healthy population of tribal members because they took a strong leadership role. They put dentistry as a high priority.
The purpose of the Arizona American Indian Oral Health Initiative is to facilitate collaboration and community-based partnerships among tribes, urban Indian communities, state agencies, Indian Health Service, and other important stakeholders to take a more proactive approach towards improving oral health among our American Indian communities. This initiative is dedicated to supporting and sustaining a statewide Arizona American Indian Oral Health Coalition that will assist in reversing existing oral health disparities and promoting healthier communities by enhancing dental education and expanding access to prevention and treatment services.
It needs to be a collaborative effort between every tribe within Arizona to network, to communicate, to support one another in their efforts in establishing oral health coalitions by each tribe and each having a tribally driven project. Each one of them is creating opportunities to transcend borders, not just in local tribes in the Four Corners area, but nationally throughout the entire United States for all fairly recognized American Indian tribes.
It takes the message, it takes the information to the tribes, it brings in the community, so it's not necessarily the Indian Health Service or it's not the dentist or the dental clinic telling the community what needs to be done, it's the community itself, and all of us acting as advisors and helpers and on a team with a bigger consortium or a collaborative group could come together and give the community a lot of options of what they can do and a lot of help. They can give them support to materials, equipment, supplies, information, education, and all the encouragement and coaching that we can do. I think that's something that we haven't tried in the past, and I think doing that has a good chance of bringing it to the people that can really do something more, expanding care to outside just the clinic, and bring it to a model of more of a health model rather than a repair and replace model. And I think that's one of the big things that we need to look forward to in the future. So I'm hoping the oral health initiative that comes through for the tribes and the organizations will make a big dent in that problem.